Hey there, welcome to One Mind Brainwaves. I'm Laurie Hernandez, guest hosting for Brandon Staglin this week. Today's topic is youth mental health, the road to recovery. I know in the past I've struggled and still do struggle with depression and PTSD. Some things that help me cope when I'm going through a tough time mentally is playing music, or even sometimes going to practice and spending time with my friends is so important. Different hobbies still do include music, and I actually like to write as well. And on the bad days, I turn to my inner circle, my friends, my family, and my siblings. So when it comes to more serious psychiatric illnesses, early intervention is critical. And One Mind is dedicated to helping people get the diagnosis, support, and treatment they need to recover and thrive. In a few minutes, we're going to talk with two people who are instrumental to Strong 365 and Aspire, One Mind's mental health programs for young people. But first, a song about the light at the end of the tunnel, one that expresses so well the emotions many feel when they finally find themselves on the path to recovery. And here to perform it is a talented singer-songwriter from Northern California, Shane Soldinger. Shane, welcome, and thank you so much for joining us on Brainwaves.
My pleasure. Thanks for having me today.
So you have not only one, but two careers that would be the envy of many. You work as a sommelier in the Napa Valley wine industry. And after traveling the world performing, you continue to play regularly around the Bay Area with your band. So what do you enjoy more?
Oh my gosh, that is a very good question. I wouldn't be able to choose. I mean, I love them both, and I feel very blessed and fortunate to be able to work with both music and wine on a regular basis. I think if you would have asked me that question maybe 15 or 20 years ago, I would have been more adamant about one or the other. I probably would have felt I've got to go all in one and not the other. But over time, you learn to cultivate the things that you love and find that balance. And I was fortunately able to find that balance a while ago and really enjoy both wine and music. It's just a part of who I am. So just feel really lucky to be able to do them both.
Well, that sounds wonderful. I'm excited for you. I'm glad that you love both.
Thank you.
The hit song made famous by the late, great reggae and soul artist Johnny Nash, I Can See Clearly Now, is a celebration of joy, but it's also an anthem for anyone who has struggled through tough times. So how does it resonate with you?
It's such a great song. And, I think one of the things about a great song is that a great song always stays relevant in your life at different times, and it's able to change with the times and with you. So it's you may love a song 10 years ago, and then you hear it again, and it means something completely different and totally more relevant to your life today. So I Can See Clearly is definitely one of those songs. I know for me personally, I've always enjoyed it, but I was asked by the Staglin family a number of years ago to play that song for a memorial service that they were hosting, and just seeing the power of that song and how people reacted to it, and seeing that it really brought a lot of strength and joy in a really tough time. That really resonated with me, and I had never looked at the song like that previously. So, I haven't really played that song since, and Brandon called me up about a week ago and asked if I would be able to share the song with everybody today. And I'd do anything for Brandon and the Staglins, so of course the answer was yes. But going through the song again, it hit me in a different way, and it really is it's such a great song. It brings really classic themes, about the embracing light versus dark, and good versus bad, and it's really just a song of strength and beauty and perseverance. So I was really, really glad to be able to revisit that again.
Well, thank you so much for sharing that with us. Would you mind singing for us and showing us that song?
Okay, yeah, absolutely. Here we go. All right, so this is be a little different version than the late, great Johnny Nash, but here we go. I can see clearly now, the rain is gone. And I can see all the obstacles in my way, and gone are the dark clouds that had me blind. It's gonna be a bright sunshiny day. It's gonna be a bright sunshiny day. I think I can make it now, the pain is gone, and all of the bad feelings had disappeared. And here is the rainbow I've been praying for. It's gonna be a bright sunshiny day. It's gonna be a bright sunshiny day. Look all around, there's nothing but blue skies. Look all around, there's nothing but blue skies. And I can see clearly now, the rain is gone. I can see all obstacles in my way, and gone are the dark clouds that had me blind. It's gonna be a bright sunshiny day. It's gonna be a bright sunshiny day. It's gonna be a bright sunshiny day. It's gonna be a bright sunshiny day.
Yay! Oh, that was wonderful. Thank you so much for sharing that with us.
Pleasure. Thank you. Thanks so much. That was fun.
That was wonderful. I enjoyed that so much. I was definitely singing along, even though I was definitely on mute as well. With me now to discuss youth mental health and the road to recovery, Dr. Tara Niendam is the Executive Director of the Early Psychosis Programs at UC Davis, where she's also an Associate Professor in the Department of Psychiatry. Chantel Garrett is the founder and executive director of Strong 365, a one-mind project to connect young people with quality mental health support. Tara and Chantel, welcome to Brainwaves.
Thank you.
Viewers, don't forget you can post questions for our guests in the comments section of this webcast at any time. And Tara, I'm going to begin with you. What is psychosis and how does it develop? What causes it? And what's the typical age of onset?
Okay, those are a lot of questions. So I'm going to share a lot of knowledge as quickly as I can because they're really important questions. And I'll be honest, they're the first ones I always get. So I think it's a great place actually for us to start. So when we think about psychosis, psychosis really refers to thoughts or sensory experiences that aren't in line with what's happening in the here and now. We think of it as a continuum from low-end experiences that we all have. Like I'm sure, Laurie, you've probably thought you heard or felt your cell phone going off one time when it wasn't actually going off. And that's an example of your mind playing tricks on you, and you just put your phone away and move on with your day. And this can actually go up through the continuum to experiences that can be scary or impact everyday functioning, like really distract you from the things that you're supposed to be doing each day, like hearing voices that tell you to do things, or believing that the government or someone is tracking your every move. These experiences can occur in the context of a variety of situations, such as with drug use, or during periods of depression, or even in aging disorders like dementia. But there are some situations where psychosis is the primary concern, and we call these psychotic disorders. And an example diagnosis would be schizophrenia. We think of these disorders as brain-based neurodevelopmental disorders. And so that means they show up during adolescence and young adulthood. I tend to see folks between the ages of 13 to 20 having these experiences, although it can go younger and it can go older, particularly in women. We sometimes see that women have an onset a little bit later. We know that this is brain-based because we see differences in cognition, attention, and memory, as well as in aspects of brain structure and function for individuals with psychosis. But we don't know exactly what causes these things, like genes. There's hundreds of genes that we have found that are associated, but not any one specific gene. We also know that it's an interaction between a person's biology and their environment, which means we can intervene on both of these sides. We can intervene with medication or other medical treatments on the biological side, and then with environmental supports to increase resilience and decrease stress. For some people, we see early, subtle clinical signs that they may be at higher risk for developing these full psychotic symptoms. And we use clinical interviews to determine if someone is showing these signs. And we look for these very specific experiences, and we want to see that they're happening regularly and that they're having a negative impact on the person. So maybe instead of seeing people or hearing voices, maybe they're seeing shadows or hearing whispers or laughter when nobody's there. And these experiences are happening maybe once a week or a couple times a month, and it bothers them. Those are the subtle signs that we look for. And data shows that between 25 to 35% of individuals with these early signs go on to develop that more significant symptoms of psychosis. So this window of what we call high-risk symptoms gives us a great opportunity for early intervention to prevent worsening of the symptoms and support current levels of functioning.
Oh, wow. I'm not going to lie. I didn't know any of that. So that's really interesting to listen to. I'm sure those who are listening to as well, probably, I'm sure a lot of them will connect in some way. So thank you so much for sharing that with us. One Mind's initiative, ASPIRE, stands for Accelerating Serious Psychiatric Illness Recovery, and it identifies 5 essential components to help people on the road from suffering to potential recovery. How does early access to care improve patients' prospects for a full and fulfilling life?
Yeah, that's a really important question. When we catch people early in the illness, the experiences are still odd. It still seems strange, and people question them. Like, what is that shadow? Why does my phone keep ringing when it's not ringing? And so we're able to sort of capitalize on that questioning in treatment and say, yes, let's explore that thought. Let's question why this may be real or might not be real. We also see that early in the course of illness, people still have social supports. Like you mentioned, your friends, your family, your siblings, that those people are all still around them and are connected to the individual. And having those meaningful relationships is key to recovery. Family and chosen family can be superpowers towards wellness. Many individuals are often still in work, still in school, still active in their community. And so it gives us this opportunity to preserve what's going on in their life and enhance it, rather than having someone struggle, have their social supports, their work and school supports, their community slip away, and they're very isolated. Then we have to rebuild, and that can be very difficult. So early intervention allows us to preserve, protect, and enhance what's already there and get someone back on the road that they were already on before. So it's really key in that area.
Oh my goodness. Chantel, you left a long career in the corporate world to launch Strong 365 in 2014. Why was this mission of supporting youth mental health so important to you?
Yeah, well, starting Strong 365 was ultimately about kind of creating the resource that I felt that my family never had in supporting my brother, who was diagnosed with schizophrenia when he was 20 years old. So very much along the lines of the folks that Tara was talking about, right in that age group. At the time, I was just 22. We're really close in age, and I didn't know how to best support him. And it was really hard to find good information about how he could be best supported, particularly, and Tara touched upon this too, in the ways that he wanted to be supported. For him, he was a Marine. He had just done his basic training and had a job in the Marines. And that for him was a pathway to college. So for all of that to suddenly be interrupted was, devastating for him. And the message that he got from his care providers at the VA at the time, and this was 20 years ago, was, hey, listen, you need to get on disability. You will be fully supported by the VA, but don't expect to have a life that you want to lead. Don't expect to go to school. Don't expect to have a job your whole life. And what we saw was this, not only deterioration of his health, but really deterioration of his hope, like his hopefulness. And so as a family member, it was very hard to hang on to that hope when there was a huge gap in resources and information, that we could find that would actually, meet his needs, his actual needs around things like relationships and hanging on to friendships and hanging on to a job and getting into college. Those were the things that were really important. But instead, he was handed a pill bottle and then kind of had this revolving, door experiences with hospitalizations and very few interactions with treatment in between. So that was kind of what that was for a long time. And so I went into the corporate space and I was a marketer for financial services firms and technology firms, large and small, and primarily did marketing and branding and advertising and things like that. But had always had this deep passion in this space. And I did a lot of volunteering for organizations or, doing advocacy. And a lot of it was stigma reduction focused. And that was gratifying and really good. But at the time, I also felt like here I am doing this work around stigma as a volunteer when I felt like my family's house was continually on fire. And it just didn't feel like enough, frankly. And so down the road, finally in 2014, I took a leap from the corporate space and essentially wanted to use my skill set in marketing to see if I could kind of build the resources that I felt that I needed, 20 years prior, at that time, 15 years prior. And so what we do today is essentially, create an online experience and a community for people who are seeking information about psychosis, provide education and peer support, as well as linkage to the care that Dr. Niendam was talking about across the United States.
Thank you so much for sharing that with all of us. I know, I think especially recently, mental illnesses or depression and anxiety has been a very common conversation, and other mental illnesses have been left out. And those two have been the most talked about. And yes, that's wonderful, but we're excluding others. So this conversation, I feel is very important, and I'm grateful that I get to talk to both of you. So thank you. Your work to help youth struggling with mental health is very innovative. Tell us about Strong 365's campaign to engage and empower young people to connect with care as early as possible.
Yeah. And so, one of the key things, and I think Dr. Niendam mentioned it, but one of the critical pieces that we know, about the brain and the body and how sort of we react to early intervention is that it matters. It really, really matters if you show up and begin to be supported, in an evidence-based way when you're having those early experiences that Dr. Niendam talked about versus when you are farther down that spectrum. And, for my brother, by the time, he received some support and care, he was very far down the pathway. And still today in the United States, this is what it looks like, where most people are hospitalized and potentially have an even kind of traumatic experience, frankly, getting to the hospital or being held in a hospital. And so we would love with online education and linkage to care to try to avoid some of that unnecessary trauma that takes place and hopefully see that people get into care earlier. So that was a long way to tell you that we are building an online community and resource for young people and their families to connect to this specialized early treatment for psychosis. And we have kind of two ways of doing that. One is our national resource hub, which is strong365.org, where we broadly focus on mental health education. We have online peer support and linkage to these early treatment programs across the United States. And then the second is a research program that we just kicked off a few weeks ago. So it's very fresh and new, but this is in New York State. And it's a collaboration between Strong 365 and a large healthcare provider called Northwell Health, as well as a team at Columbia University that sort of oversees a network of early intervention programs across the state of New York who are serving young people with these early experiences of psychosis. And for this project, what we really want to understand is what is the online pathway to care for psychosis in the United States. And ideally, again, we really want to reduce that time that it takes someone to find appropriate and quality care. And so you can essentially think of our strategy as using social media for good, where we are placing social media and Google search ads across New York State to try to identify young people in the midst of help seeking online, seeking information related to psychosis or mental health experiences that might touch those types of experiences. And then we take them to this online experience where they can take a self-screener, so they can take a mental health quiz and kind of understand their experiences a little bit more. They can chat live with a therapist or a peer specialist. They can learn more about mental health generally, as well as psychosis specifically. And they can do things like watch videos and read stories of young people with personal experiences that hopefully they can relate with and therefore feel more confident and comfortable reaching out for help. So ultimately, we're hoping to build like a fast track to care in New York State. And in the process, I hope learn a lot about, what it looks like to seek help online and, what types of resources we should be putting online to meet people where they are as they're seeking help for possibly the very first time.
Yeah. If I could add something, I've known and worked with Chantel for a while, feel very lucky to know her. And we use Strong 365 in our clinic. They have built in the ability to have access to the resources in a variety of languages. And here in California, that's essential. So I want to really stress that Strong 365 isn't just for clients and families, it's for providers too. The resources that are there are exceptional, very high quality, right what people need, and people find it to be really useful. And the work that Chantel and her team are doing with New York State and Columbia, we really believe is going to be transformative to this pathway to care that she spoke about. I can't tell you the number of heartbreaking conversations I've had with family members who just by luck get a chance to talk to me and ask how to help their loved one. And so that's ridiculous. That getting the right care for your son, daughter, parent, sister should just be because you happened to be at a Staglin event at the right time and got a chance to talk to me or one of the other providers here in California that then get you on a pathway to care. If that were the case for cancer, that would be unacceptable. But for psychosis, that's okay. And so I really think Strong 365 and this work is going to try to make that more accessible to folks around the rest of the country. And, I think one of the challenges we're facing as a nation right now, in addition to all the other challenges we're facing right now, but one of them is easy access to mental health care. So New York is an innovator. They have been pushing this to the limit for years, and we all look to them as leaders. And so here again, New York is innovating to get their folks in the state access. So, if you're here in California, or you're in Texas, or you're in Illinois, it really is about going online and searching for things. And that's where Chantel's work is so important. So, I think one of the things that One Mind has really been powerful in doing is to try to create access to everyone equally. And so I can only hope over the next year or so that folks across the country get access to these resources.
Absolutely. I mean, can other states adopt like the California and New York models?
California, I wouldn't necessarily hold up as a model just yet. We're getting there. But the New York model, I think New York is so powerful because they are collaborative and linked. There's a statewide approach. And so that makes it easier for Northwell Health and Strong 365 to come in and partner and make these resources available, because then they can come to one place and they get seamlessly connected to the clinics that exist across the state. And that's not as easy here in California.
Yeah. So now, speaking of California, I know you've developed an early psychosis intervention network, which aims to accelerate youth recovery statewide by using research to improve care. So go ahead and tell us about Epical.
Yeah, this is our attempt to try to be closer to New York. Here in California, we do everything county by county. Every county has the power to choose how they spend their money and the services they build. Now, about a decade ago, there were some really innovative people working at the Mental Health Services and Accountability Commission, which is a state organization, that saw that early psychosis was a key area that we needed to focus on. And so they invested money through Prop 63, or the Mental Health Services Act, sometimes known as the Millionaire's Tax. And this money goes to mental health care in a couple of different buckets. But one of those buckets is prevention and early intervention funds. And so some great counties said, aha, here's our opportunity to get into the early psychosis game. So many counties jumped in. Back in 2017, there's about 30 counties out of 58 plus one other area. And so that's a little over, about half the state, but everybody was doing their own thing. Everybody was providing different types of treatment. Nothing was coordinated. People didn't know how to find them. And so Epical is really about trying to bring all of these clinics and these counties together, learning from each other. What are we doing? What's working? What's not working? And how can we create a more harmonized approach here in California? Additionally, the basis of it is to collect some important data to see how the care we're providing is impacting the clients, families, and communities that we're serving. Are we doing a good job, or are we not doing a good job? And then how can we do better? So we're very excited to have 7 counties who've joined us in this initiative, as well as 4 University of California programs in Stanford. And we have counties joining all the time, which is very exciting, to come together and be part of what we are calling a learning healthcare network. We've been engaging with stakeholders across all of these programs to understand the outcomes that matter to them. And we have created a tablet-based data collection system, which now is also going to be available on the web, thanks to COVID, so that we can collect this data and then feed it back into the clinic, so that clinicians, physicians, peer and family advocates can sit with the clients and families and talk about the data and say, I really see that you're not engaging with friends anymore. That's a change from 6 months ago. What happened? How do we get you involved again? We see at these, state level kind of collaborations, lots of data collection for the purpose of the state. And so the programs and counties really said, we want to do something for our clients and families with this data. And so we've taken that request and built something for them. And we're very proud that our collaboration here in California has been linked to a national initiative called EpiNet, which is going to be connecting 8 of these networks together across the United States for data sharing and learning. Again, so we can strive toward that national approach to early psychosis care. So no matter where you live, you can get access to the care you need. So if folks want to learn more about the project, they can go to our website. It's epical.ucdavis.edu. Please notice no www. So epical.ucdavis.edu.
So it's based on the coordinated specialty care model, a comprehensive approach based on each patient's personal goals. Why does this treatment strategy work so well for young people and their families?
Well, as Chantel was sort of talking about, when people are experiencing the onset of these symptoms, they are usually still very close to their families. Their families may be the first ones to reach out for help, or their roommates may be the people who are reaching out for help. And so coordinated specialty care is really about wrapping the family and the client in services that are targeting their needs. So yes, we have therapists, well-trained clinicians. Yes, we have psychiatrists who have knowledge about the latest advances in medication. But we also bring to the table supported education and employment. You know, Chantel's brother wanted to go to school, and he should have gone to school. And so we have one staff member, in some programs there's many, whose job it is to get folks to school or get folks a job. We have peers on the team. Those could be peers for the family members, so who are able to come with their lived experience, having a child with psychotic symptoms and speak to the challenges that they experience. We also have peers with their own lived experience with mental health challenge who can speak to families or speak to clients about what that means. And help to support the clients and families in linking to resources, again, so they can keep moving forward with the things that are important to them. Oftentimes, we provide services in individual formats, sometimes in family formats, in groups, really trying to meet the client and the family where they are, so that they can keep moving forward towards their goals. And all of this is done in a team-based approach. Most often now, when we go out and we look for mental health care, we have a psychiatrist over here and a therapist over here and maybe some school support, and nobody ever talks to the other people. In our program, every week we meet together and we talk about all of our cases and make sure everybody has what they need. And it is in that team approach that we are so much more efficient and effective in helping our clients and families.
That connection is so important. I mean, I can only imagine. I know for us in pro athlete analogy, my physical therapist and my personal trainer are always keeping in touch, because if I have an injury, then one needs to let the other know so that we can either fix it or we can strengthen it. So I love that you're able to talk about that connection and get everybody connected. As a guest reminder, we are talking today about youth mental health and the road to recovery with Dr. Tara Niendam, Executive Director of the Early Psychosis Programs at the UC Davis, and Chantel Garrett, Founder and Executive Director of Strong 365. Viewers, don't forget, we want to hear from you. So feel free to post questions for our guests. What is your biggest challenge? How have you overcome it? And how are you caring for yourself and your mental health during the pandemic? If you know anyone who can benefit from the information provided from our guests today, please share this webcast with them. Okay, Chantel, a big part of Strong 365 is the peer-to-peer interaction, knowing that you're not alone. How does sharing their stories help young people stay strong in their struggles to maintain good brain health?
Yeah, it's such a great question. And one of the things I didn't say earlier, because there's just so much to say and explain, is that we could not do the work that we do without an incredible board of young people serving on our youth leadership board. These are people across the United States who have all had experiences as young people, with psychosis. And some of them have had the benefit of going to one of these early treatment programs and receiving some of this comprehensive care that Dr. Niendam has talked about. And some of them have managed to piece together sort of a similar type program, but really on their own, with a ton of family and maybe chosen family support. So the important thing to note is that they have really been the lifeblood of the organization, but have really guided our strategy and our approach. And one of the things that we have heard from them from day one and continue to hear from all the young people we work with is that this feeling of being alone, that you are, especially in these experiences, possibly the only person on the planet who's ever, heard something that isn't there, or seen something that maybe isn't there, or felt like you were being persecuted, or that someone was out to get you. I think it's one thing, and you talked about this, Laurie, to talk about what it feels like to not be able to get out of bed in the morning or throughout the day because you are just stricken with depression. Many of us can sort of relate with that. Anxiety, same thing. Many of us, especially during COVID, can relate with what it feels like to feel that crushing anxiety. But these experiences, related to psychosis, whether it's sensory or some thoughts that maybe you feel that you can't control and are bothersome, these still have a lot of stigma attached. So having people share their experiences, and it kind of normalizes and really humanizes it, puts a face to some of these experiences, and helps people know that, no, you are not the only person on the planet. In fact, there's people all around you who have these experiences. And I know when I first started talking about my brother's experience, and it took me a long time to be able to do that, especially on his behalf with his okay, people came out of the woodwork, especially in a corporate environment. They would stop by my desk in my office. Hey, can I talk to you for a minute about, my son, myself, my daughter, my cousin, my nephew, and so it is much more universal than we think about. And personal storytelling is critical to helping people feel empowered to ask for help, to really take that next step. So that's really what, Strong 365 is, essentially a platform to enable young people to share their stories. We call them stories of strength. And we have people from all around, even the world, who submit stories. You can go on our blog and visit our YouTube channel. But we have videos and stories from people, or videos and written stories from people, sharing these experiences. And I am incredibly humbled just to sort of create the means through which people can tell these incredibly powerful stories.
Oh, I'm inspired just by listening. This next question is for either of you. How can employers and school systems be better prepared to be part of this comprehensive, holistic support and treatment model?
Yeah, I think we need to do better by partnering. I think, really being able to partner with local programs. Before I was at UC Davis, I was at UCLA doing very similar work. And I would offer free trainings to anyone in the community who would listen to me. And I really tried to target the schools. And, there was a lot of barriers, a lot of challenges to making that happen. When I moved up here to Sacramento, it was amazing. It was transformative. The community here is so open to bringing in any resources you can think of. And so we've been so proud to have an ongoing partnership with multiple school districts here in Sacramento who are eager to bring in any information that they can get, develop new programs, participate in research studies, anything they can do to serve their communities better. So it has been transformative for our research, our clinical care, our community to build these partnerships. And so, I would say to employers and school systems, look around. There are people in the community who can support your students, your staff, and just reach out. And more often than not, they're going to be excited to partner with you. I do think as employers right now, I'm a manager and I have staff, and it's a challenging time to be able to provide the right support that people need. I have staff that are doing well, and I have staff that are struggling. And so I think for me as a manager, I work very carefully with my HR to make sure I know what I'm allowed to do and what I'm not allowed to do. I also try very, very hard to make sure that I know the resources that I can offer to my staff. And then I tell my staff I care about them as people. They're people first to me, and they're employees second. And so whatever I can do to help support them, and just making a space where it's okay to be a person who's struggling. And I tell them they don't have to get specific. They don't have to tell me, anything that they don't want to share. But my goal is just to help them be successful. And whatever I can do, whatever resources I can pull in, that's my goal. And I think it's been fairly helpful in creating, and it's really a cultural shift. It's very much a cultural shift to create that space in the workforce. And so I would really challenge workplaces to look at their environment and their culture and to see if they're putting people first.
Yeah, I was going to say, as someone who's in the position that you are, being able to care about mental health and care about, the mental health of those that work for you, it allows them to also care for each other. It shows that it's important. So that is such a great point, and I'm so glad that you hit on that. Despite what we know will be a tidal wave of mental health challenges in the wake of the pandemic, possibly even more so among young people, what gives you both hope for the future?
I'll kick off. For me, I think it's along the lines of what I had said a few minutes ago about young people. I am just continually astounded by this generation of young people kind of coming up in their advocacy, finding their voices, not just in mental health advocacy, as needed and as amazing as that is, and it's really changing and evolving. But in all kinds of sectors, right? We see so much happening in social justice, so much happening around, identities and LGBTQ and so on and so forth. I mean, all of this is going to be needed for the social change that we need in order to, become more healthy as a nation, really, from like a, population health perspective. And that's a cultural shift and change that needs to happen on a national level. So it's going to rely on these young people to continue to, raise their voices and become, activists and really push us forward in progressive ways when we think about health and especially mental health. So that's where I'm putting my hope, is the young people. They keep me inspired and excited to continue to get up each day and do the work. How about you, Dr. Niendam?
Yeah, no, I'm like sitting here like grinning ear to ear because mine's the same. I am just like so excited by the openness that youth have right now. I mean, I'm not that old, but it's still mind-boggling to me where youth are at compared to even where I was when I was in school. Like, I have an 8-year-old daughter, and she will talk about anxiety. She will talk about depression. She'll talk about race, gender, sex, in such like open ways. I'm just like, oh, thank God, this is what we need everywhere. So I have so much hope because of the youth today. I have to say the other thing is the peer movement. I really am so excited by the movement of peers into the mental health space. They're challenging us. They're challenging our notions of expertise, of power, and this traditional medical model of care and wellness. I think lots of people can take different paths to wellness. And so I just deeply, deeply respect and appreciate their consistent, challenging voices that are making the clinical community, the research community, everyone sort of pause and really think deeply about the structures that we have in place and how those structures are either maintaining inequality or are starting to break down the barriers that exist. And I think that this is critically important for healthcare and mental health care.
Wow. Thank you both so much for taking the time to speak with me today. I know that everybody listening is going to be just so grateful and will connect to this. I appreciate both of you. Thank you, viewers. Thank you too. You can post questions on onemind.org/brainwaves. For more information, visit onemind.org/aspire and strong365.org. Thank you. Stay safe.
You're feeling anxious, afraid, alone. I haven't been able to see my family or my friends.
Families that struggled to find mental health care before find it even harder now.
I feel a lot of guilt in not being with my family.
Are there solutions? Visit onemind.org. Seeking the answers, bringing help to the front lines. Accelerating brain health for all. Help us fund new treatments at onemind.org.